Hello, and welcome back to episode 4 of Careers Unplugged, where we uncover the real stories behind professional life. Today we're exploring the pathways to medicine. I'm joined by Taanya, our Life Sciences Secretary in the Careers Advancement Network, to discuss the different routes into the medical profession and how students can best prepare for a career in healthcare. Welcome to the podcast, Taanya. What initially inspired you to pursue a career in medicine after your undergraduate?
So I've always been interested in medicine. It's something that I've been dreaming of since I was a child. And after I did a lot of work experiences, I kept seeing how doctors are so involved in the patients and how well they take care of the patients, including the MDT as well. So MDT stands for Multidisciplinary Team. They're a team of other healthcare professionals along with doctors who take very precise care for their patients who are in hospital and who are also leaving the hospital. So after seeing this during work experiences, it really ignited my wish to do medicine further. And I also think being around medical professionals, you feel the the sort of support they give and how safe you feel around them. And I wish to provide that sort of safe place for the patients that I hope to take care of in the future if I hopefully get into medicine myself.
I'll keep my fingers crossed for you. Okay, what steps should a biomedical sciences graduate take if they're considering switching to medicine?
So some of the things they need to consider is the difference between a degree in life sciences and degree in medicine. So whereas in life sciences we are very skewed towards staying in lab and having little to no interaction with the patients. Both whilst doing a degree in medicine and also after graduating with a degree in medicine, you have a lot of patient exposure. You're exposed to the MDT, you're exposed to so many different people, you're exposed to people with so many different conditions and so many different levels of care needed, and also you'll be exposed to their family and friends who are in different emotional states and need support. I think it's really important to know that you'll have to be a lot more people-based, whereas in life sciences or in biomedical science, you're definitely a lot more in the lab. And second of all, there's a lot more duty on you, if that makes sense. Essentially, during laboratory medicine, you are in the lab, you're responsible for the petri dishes, the samples that you're involved with, and also the later on potential diagnosis that you can make once you have essentially diagnosed and looked into the samples. Whereas with medicine, it's a lot more than just looking into samples. You're looking at the patient as a whole, as a person. You're looking at the microscopic side of it as well. Of course, you've got the lab samples coming back. And depending on what type of doctor you are, you'll be looking quite literally into the patient as a surgeon. And also as a clinician, you'll be looking at their mental health, their physical health, how are their family and friends reacting or responding to perhaps a disease diagnosis that's quite unfortunate, if that makes sense. So I think it's definitely really important to consider the massive difference between medicine and just life sciences in general.
Wonderful. And how can students leverage their life sciences background in order to stand out in medical school applications?
So something that I will always say to any friends or anyone who are perhaps in year one or even lower than that in their education stages is that look into work experiences. I think something that every medical school looks into is, have you understood what it is to be a doctor? Have you understood what it is to take care of patients? Whereas in life sciences, you do look at a certain part of the patient, but you don't look at the patient as a whole. And that's what doctors do. And that's what they want you to know in medical school, is that you're not just stuck with the textbook, you're not just stuck with samples. You are stuck with living beings in front of you who have essentially put their life in your hands and in hopes that you can figure out what is wrong with them or how they can improve their life. So work experience is my top choice in terms of what you need to do to stand out in a medical application. And second of all, just showing a passion in medicine. Obviously, doing work experiences shows a part of you want to do medicine later on. It shows your passion for it, but also other stuff such as volunteering in stuff like hospices and stuff. It shows how much you want to help the greater community. And as I said earlier, being a doctor means looking at the patient as a whole. You're seeing them not only in a medical setting, you're looking at them outside of a medical setting, how they're taken care of outside of it. And medical schools really like that. So you see, like Warwick University, they have sort of very particular preferences on how much work experience they want you to have, and what you gain from the work experience. They're really focused, they really fine tune on that aspect. So I definitely recommend work experience and volunteering in healthcare and also non-healthcare settings. Something that I would recommend not doing is that, or perhaps limiting how much you do, is picking laboratory medicine work experiences over clinical work experiences, because laboratory one, although as I said earlier, it does show a part of the patient that you don't see on a day-to-day basis, it doesn't show you the patient as a whole, and that's what universities really look out for. So work experience, volunteering, trying to limit your laboratory and instead converting that into a more clinical and a more holistic approach instead is something I would definitely say to leverage and stand out in medical school applications.
Yeah, can we talk more about the laboratory experience? Sorry, that's a difficult word to say. So what would be kind of the disadvantages of having laboratory experience, just so we can get both sides of the argument?
So it's not essentially a disadvantage, it's rather making use of the time that you have, because if you look at the overall timeline of doing graduate engineering medicine, you start off in year one as a biomedical science or biochemistry, whatever life science degree you do, and from then onwards you have around 2 years or even less than that in terms of months to essentially figure out your entire medical application. So you have to do quite a few hours of volunteering, quite a few hours of work experiences and placements and shadowing GPs, hospitals, whatever it is that you choose to do. You also need to stand out in your application in other ways as well, because in graduate engineering medicine is getting more and more competitive as the year goes on. We have people from masters and PhD trying to fight for the same positions that you're applying to. So perhaps trying to go into societies, getting involved in these perhaps medical societies, perhaps societies such as they're focusing in biomedical, even if that's something that you wish to go for, to show that you have teamwork skills and you have leadership skills, because that's something they really look forward to, and also ask during interviews. They ask you things such as, what have you done that shows your leadership skills? And if you don't have an answer to it, that can put you in a really bad position. Whereas getting involved in these societies means that you gain those skills, you can show those skills to the interviewers, and also stand out from the rest of the applicants. So essentially, instead of putting yourself into non-medical sort of experiences or laboratory medicine, I definitely say switch more towards clinical, looking at patients as a whole, and also to show those skills in teamwork and leadership.
Okay, if someone is interested in medicine but is unsure whether this career path is for them, what is the best way they can actually gain experience and test the waters before fully committing?
So one of the answers is work experience, as I mentioned many times earlier. It's to see in like face to face what doctors do, whereas you see obviously in TV shows and stuff what doctors can do, it is obviously a form of exaggeration.
Shout out Grey's Anatomy.
There's so much exaggeration in a lot of medical shows, and not all of them. I think there's like very few that are quite accurate, both in the techniques that they use and also just in general. Like so many times they show the wrong type of CPR. They shout out random words instead of showing what's actually going on in a medical setting. They make it seem a lot more stressful to be a doctor, as in the patient's going to die on top of you, whereas in real life it's a lot more. You have a lot more people helping you. You have the MDT. They tend to forget that, especially, and I think that it definitely it's a lot. I had a very different perspective to medicine as well before I went to work experience, and I saw, okay, it's a lot more coordinated. It's a lot more, you have a lot more, like nurses are a lot more involved in this, in healthcare settings. You have clinical support workers who are a lot more involved as well, and they're so nice, they're so sweet, whereas in TV shows they don't show that. So I think definitely work experience is, in hospitals, I'd say definitely, is the way to go to figure out if medicine's the right path. And also, a quick Google search can help you. There's a lot of blogs, a lot of vlogs as well from doctors, junior doctors. There's like obviously a rise of YouTubers who are also either medical students or junior doctors, or even like senior doctors and consultants who are opening up YouTube channels to show what it is to actually be in that career path, and to be and if you're someone who's got like you want to be a neurologist, for example, or neurosurgeon, you got neurosurgeons online who show what it's like a day in the life of a neurosurgeon. And that, I think, definitely puts into perspective how much workload they have. And I think that's something I recommend as well. Looking into vlogs or blogs and work experiences are my top 3 advisors.
And what is the best way that biomedical students can actually gain work experience?
So work experience, actually recently it has been quite difficult. In fact, when I applied for work experience way back in October, they had more than 200 applicants for the same work experience that I applied to. So it is quite competitive. You do have to make competitive application even for work experience. But one way to do is to look at the NHS Foundation Trusts and go to the website and see their sort of websites or their page for work experiences. Not all of them will have work experience pages. For example, the Manchester one doesn't. So in those cases, it's better to actually contact the doctors themselves, or even physician associates, clinical support workers, anyone you can get hold of. Contact them, talk to them, and get some information and emails through them as to how to get work experiences. However, for example, the University of Morecambe Bay ones, they've got online websites for it, and they've got an opening every 3 times in a year to help students out for work experiences. So it's either online or you'd contact in person.
Okay. And let's go back to the process of entering medical school. So what transferable skills from life sciences can help students excel becoming future doctors?
So in terms of the skill you get in the biomedical degree itself, I think we have teamwork skills. Now, this is something that not a lot of people talk about in their personal statements and such, because a lot of people who are not in the biomedical career paths tend to only see us as laboratory medicine, and we just sort of stick to ourselves, which is really untrue. We do have a lot of teamwork skills. We work, even in a lab, we do work as a team. We've got certain people doing certain parts of a procedure. Talking and communication is extremely important, and that's something that you see exactly the same in medicine. Talking to your peers, talking to other members of the MDT are really key in making sure that the patient's treatment plan goes well, and that's something we do see in biomedical sciences. And another thing is presentation, and by this I mean that especially here in Lancaster, we have sort of modules where we do presentations. We present in front of within our cohort or within our teachers, and this is something that you definitely see in junior doctors, which is where they have to sort of sit around with a lot of people who are a lot higher, such as registrars or such as consultants, and they have to present the case studies. They have to stand up in front of everyone and say, here is patient X. Patient X has come to the hospital with these sort of symptoms, and then we did these sort of scans or these sort of tests, and we find out that they have this, and these are potential diagnoses. How do we proceed with the treatment plan? And then the consultants chime in and add their expertise, and everyone together works out how to help this patient out. And through these presentation skills, are these students able to perform their best in these sort of situations where they had to present in front of consultants, and that's something we do gain from our biomedical science modules. And I'm really glad we gained that skills as well, because definitely it can be quite unnerving when you're stood in front of a lot of people. And once you gain that skills, it's honestly a lot easy. Once you gain that confidence, you can do that both in our degree and also further on in medicine. So yeah, these are a couple of transferable skills I definitely say we have.
Here's another question. How do medical schools view applicants from a biomedical sciences background, perhaps compared to those who are applying straight from sixth form?
So
do they view them any different?
So I split that into 2 different parts, because once you finish your bachelor's degree, you can either apply for graduate engineering medicine or you can apply for undergraduate. Now, obviously, the undergraduate degree, which is a 5-year course, that one is applied to by mostly sixth form students who are in year 12 and year 13 who apply to those. And in terms of those who wish to finish their bachelor's and go on to a 5-year degree, I think that there is a slight difference in the application process. Obviously, you are applying using your 2-1 or your first degree, and whereas in terms of priorities, it is unknown because universities don't reveal the information in that way. However, I think they do try to keep it pretty similar because it's a bit difficult to compare someone who's done a degree to someone who's done A-levels. And they don't easily reveal whether they're given priority to one or another. However, if you look at the graduate entry, it is slightly different because graduate entry is not applied by anyone from A-levels. It is purely, you're competing purely with either BSc or Masters or PhD students. So overall, they do see people who graduate for the degree as more mature. They do see us as, we're obviously older, we're adults, whereas people applying from A-levels are essentially children. Well, not children, they're under 18 or they just turned 18. So in terms of mental maturity, they do expect perhaps more from bachelor students, and they probably expect more in terms of experiences. You've had longer to do more things under clinical settings, whereas a student in sixth form, they've not had as much. There's a lot of restrictions in work experiences for anyone under 18. They're not allowed to go in theatres, they're not allowed to go in certain aspects such as emergency medical departments and so on. So I'd say that they perhaps expect more from someone who's applying after a degree than compared to someone who's applying from straight from A-levels.
So I kind of asked this question on our last episode, but do you think if someone is applying from like a non-science background, do you think they have a disadvantage in applying to medical school?
So this is actually a really good question because that's something that gets flagged up by a lot of people who are from non-sciences background, and they really worry themselves into thinking that they may have a disadvantage compared to science backgrounds.
Yeah.
So the way the universities, there are a few universities that are science background only. I believe, actually I'm not sure, I think Manchester, but I might be wrong on that. Okay. Whereas there are universities such as
Do your research, guys.
Yeah, do research because it's all online, honestly. It just takes quite a bit of time to sit there, make a little table. That's what I do. I make a little table to figure out which ones are science, non-science. I have a science background, so I feel like I'm pretty okay in terms of this. However, if you're non-science, please look at which universities do science and non-science. Universities such as Warwick, I know Warwick is non-science university, so they take in any degree essentially, but in terms of the entrance exams, for example the GAMSAT, that's where I think they might struggle a little bit because GAMSAT, one of the sections is purely science. It's got biology, chemistry, physics and maths. So if you've perhaps done A-level biology, chemistry and physics or maths, you might be in a okay position because you've got the background knowledge. You just need to revise. Like you just need to bring that memory back from those times. However, even if that is the case, they require you to do biology and chemistry at a university level. So if you're doing a non-science degree, that can be quite tricky. But I believe there are loads of resources online to help those non-sciences background students to get to the knowledge that they need. So yeah, I think that even though it can be quite scary, there are a lot of people who've been successful. I know people who've done an art degree and got into medicine, people who do history and get into medicine. So it's definitely doable, and it can be a little more work than a science background, but trust me, it's doable. You just need to put the effort in and it'll bear you the fruit.
So you've kind of touched upon entrance exams to medical school. So how do these kind of factor into the transition? And what advice do you have for students preparing for them, as someone who's going through the process yourself?
Yes. So UCAT and GAMSA are the main exams, in case anyone's wondering. The UCAT is a purely aptitude test. I've done this before because I did apply for undergraduate way back in 2022 or 23, I'm not sure. It's been a long time. The UCAT is purely aptitude. They have made recent changes from 2025, so please look into the new changes they've made in the application process. Sometimes it just jumps upon you. Like way back when I did it, they had 5 sections. They had abstract reasoning, logical reasoning, verbal reasoning, quantitative reasoning, and situational judgment. But now they've scrapped off abstract reasoning, so it's down to only 4 sections, and they are very, as I said, aptitude. So it's really hard to prepare for them in terms of theoretical knowledge. It is and it's very time constrained. That's probably the downfall for a lot of people who are doing the UCAT. You need to be very precise, very fast. And in the quantitative reasoning, where it's purely maths, you need to improve your cognitive abilities to do mathematical calculations. There is a calculator on the spot, but it has very limited use, unfortunately. So UCAT is basically one of the exams that opens up in July the 5th or 6th this year, and it finishes around mid-September, so you can pick any of those dates. Whereas the GAMSAT, it is a lot more written. So there are 3 sections in the GAMSAT. There's section 1, 2 and 3. There's a section purely on the sciences. There's a section purely to do with essentially nothing scientific. It's an essay-based exam where you have to sit down and write an essay on whatever topic they give you. So this can be politics, this can be history, this can be literally philosophy as well. There's a lot of philosophical themes that go around with section 2, which is the essay one. And the section 1 is essentially the logical reasoning. Essentially, basically they give you passages from either fictional or non-fictional, and they expect you to interpret it and understand it to a great level. In terms of how this helps us out as later on in the medical degree, UCAT, I suppose, helps you make quick decisions. When you're a doctor, when you're in a healthcare situation, and sometimes there's emergencies, you need to make decisions fast. You need to understand the situation quick enough. You need to act on it quick enough, or else you might risk losing the patient's life. So UCAT really helps in that sort of situations, whereas the GAMSAT is definitely attention to detail. As a doctor, if you miss attention to details, you might risk misdiagnosing them. You might risk...
And that's incredibly dangerous.
Yes, that can lead to so many issues. It can affect mental health, physical health of the patients, and it can lead to the wrong tests and wrong treatments administered, and that's extremely dangerous. And also a loss for both the patient and the NHS. So I think that both of them really do highlight certain aspects of being a doctor, and also sort of help you get to those skills that you need. But in terms of preparing for them, okay, everyone has different ways of preparations. UCAT, it is advised by the UCAT itself, the UCAT website itself, that you start around 3 months early, I believe. But this obviously depends on how quick learner you are, and how you are in aptitude tests. Like, I'm someone who struggles with aptitude tests. I struggled with it back then, and I'm still struggling with it when I'm trying to understand and figure out how I'm going to tackle this exam. And with UCAT, because there's no theory involved, it is definitely questions, practice questions, again and again and again, until you get it right, until you get that score. There are a lot of online platforms that provide on UCAT questions, or questions similar to the UCAT. You can try those, and they do give you sort of like a predicted how much you will get if you do this in the actual exam sort of situation. But at the end of the day, that's not necessary, because these do cost quite a bit. The UCAT website itself provides free questions. They do provide free samples, so I recommend doing those as well. In terms of the GAMSAT, so for section 1, it is...
Oh, sorry, Taanya, can I just ask you, is it the case of practice makes perfect?
So essentially for UCAT, it's just practice makes perfect. It is, you do repeatedly until you get it right. The only thing I think in the UCAT where you do need to know some theory is the situational judgment, which if anyone who's done UCAT before know how stressful it can be to figure out which of the options is correct. It's basically where they give you like a scenario where, for example, a doctor comes in smelling of alcohol, and they're about to scrub in for a surgery, and you have to figure out what you do as a junior doctor, for example. Do you report them? Do you talk to them? Do you take the alcohol away from them? Do you report them all the way to the medical director of the hospital? So it's those ones you probably do need a bit of theory to figure out what exactly a role of a junior doctor is in situations, and what a role of perhaps a medical student, or even some of the questions are, you're a work experience student, so you're not even in the medical situation, and what approach you would take to when you see a doctor doing. So those can be quite tricky, but once you get a hang of it, it's a straightforward path. In terms of GAMSAT, it's section 2. I would highlight. I would like to talk about section 2 a lot, because that's probably the most difficult for people who are both in science and non-science background. This is basically because the essay themes that they give us, and they do have quite a few examples of the themes that they have that they ask during these exams. It is on their website. The issue with the themes is that it's quite vague. They might ask you about law. They might ask you about geopolitics. And someone like me, who's in the biomedical side, or who's in the life sciences side, we're not as aware of the geopolitical side of things. We're more science. and someone in the non-sciences, even though you are in the non-sciences, you might get an essay topic that's something that you're not, specializing in. You might be a history student, but you might be asked about law, and that might be quite confusing. So I think for those, the typical recommendation by people who have previously done GAMSAT and people who are going to do GAMSAT is to read across those themes. So find those themes on the website, read a bunch of books. You might find recommendations by previous GAMSAT writers on what to do to learn about these essay topics. Learn about these, keep some bullet points, learn as much as you can, essentially. And at the end of the day, the essay asks you to give your own opinion as well. So what do you think about these geopolitical issues? What do you think about these situations? You have to essentially add your own creation into this essays, so that it's not just a copy and paste of it.
Okay. So you need to use your own initiative.
Yes, your own ideas, your own sort of. This is what the geopolitical side of this says. Future predictions, if you will. In terms of the first section, which is the logical reasoning, reading speed is you can do reading challenges online, perhaps, and you can also. If you're someone who reads novels and stuff, you can try and time yourself when you read them, and see if you understand what the writer's trying to say. You can also read into non-fictional writings as well to see if you understand perhaps the news fast enough, and this would help you a lot by cutting down time in section 1. And I think that's definitely. Other than that, it's quite difficult to prepare for section 1 because it's all about reading and understanding and interpreting what the author is essentially trying to say. The final one is section 3. This is, as I mentioned earlier, purely theory based. So you need to finesse your biology and chemistry knowledge. For science background students, your year 1 content is what they expect. They don't expect year 2 or year 3, just year 1 content in biology and chemistry. So definitely refine your knowledge on that. For non-sciences, as I said, you just have to find resources online, find maybe other students who are also from non-sciences, and perhaps ask them for help on what to learn and what topics to cover. They do have a list of topics that they can cover. You can find this in some websites that do GAMSAT training. They do have certain specific topics that they cover, such as like electromagnetism in physics, and cell division in biology, and so on and so forth. If you're someone who's done physics or maths A-level, just take out your A-level textbooks. So just take out your textbooks, the old textbooks that's in your garage, perhaps. Take them out, read through them, figure out what topics that you need to cover in those topics that you had to learn in A-level. And if you perhaps have learned physics A-level, then try and find people who've done A-level maths, and perhaps ask for the textbooks or find online resources. There's a lot of online resources for A-levels, so you can find them and learn those A-level math skills, and vice versa if you did maths A-level and you haven't done physics A-level. For non-science backgrounds, it's the same thing as if you've only done one A-level, not the other. You have to find resources online, figure out a nice timetable to learn this, because that's quite a lot of content to learn.
I can imagine.
It's a magnanimous amount. Keep files, keep everything organized, and make sure that you have sort of ticked off everything that you need to learn.
Our penultimate question: how can students balance the demands of studying an undergraduate degree while also preparing for the transition into medicine?
So, in terms of meeting the demands of a biomedical degree, I think it's all down to time management, because not only are you doing a degree, you're also managing any society work that you're doing. You're managing work experience, you're managing volunteering, you're managing any other sort of responsibilities or any other thing that's part of your day-to-day life. You're also managing keeping up with the news, keeping up with medical news, and also keeping up with any changes to the UCAS system.
Here at the Careers Advancement Network, we also love to talk about commercial awareness, and we cannot stress how important it is to keep on, reading the news.
So, I absolutely agree with keeping on medical news. It changes every single day. You might wake up one day to see no news, the next day to hear that this hospital has done this has happened to that, they're changing the laws. You can hear all sorts of different news, so keeping up with that is also important. And in terms of managing all of this together in one go, I think it's mainly down to, as I said, time management, making sure you're doing what you're doing, you know what you're doing, and making sure you have like a table or any sort of like calendar based time management softwares. Yes.
Yeah.
Anything you can get hold of in terms of helping you manage your time.
Yeah.
And
what kind of time management softwares would you recommend, Taanya?
so I use Google Calendar, which is very basic, it's free as well. So honestly,
Notion is my fave.
oh yes, Notion is another recommendation. I found Notion quite late into my year 2, therefore I haven't been incorporating it into my day-to-day life. Notion, Google Calendar. There's quite a lot of study apps that you can use to keep track of what you're doing in a day-to-day basis. In terms of time management with your studies, I think using Pomodoro technique, using any form of technique really that used to do with time. Pomodoro is my favorite. I set up like a 45-minute timer and I teach myself or to a little plushie what I've learned so that I can keep within that time, and then I can finish my content for the day or for the week within this time limit, and then I can move on to my next sort of responsibilities that I need to look into. So society work, our careers advancement. Here we do obviously our podcast production and so on, and obviously I do keep a specific time during my day or during my week that I purely dedicate to my society, and also my other societies like cancer research and so on, where I keep specific times during the week, making sure that I can cover careers advancement, cancer research, my day-to-day uni work, my coursework, my exams, and also keeping up with the medical news. And also if any universities change their requirements last minute, and this has happened before. A good example would be in the 2022 application cycle, I believe, where Cardiff University randomly decided to change their requirements from a low UCAT to a minimum of 2,600 UCAT. This has affected, including me, a lot of medical applicants because they did it so last minute, and not a lot of people saw the change. It helps you make sure that you're on top of what they're like published in terms of what you need to do for application. And also makes you more aware of where you stand in this medical application, what you need. If there's a particular university you want to go into, you can be like, okay, this university wants this many UCAT or this many GAMSAT. They want this many hours of work experience. They want this type of work experience. They want you to have these skills. Have you reached those skills? And they might also want you to have this sort of degree levels, like Nottingham wants a 2:2, and other universities typically want a 2:1 minimum. So these tables, I think I highly recommend making them so that you keep in track of what universities accept you.
Excellent stuff. And so, just our final question to conclude this interview. Who can people reach out to if they want to know more about different pathways to medicine?
So I think within obviously careers advancement, we have both STEM and life sciences. We are very much dedicated towards the science side of people. We also have, you could ask me as well, as someone who is currently applying for graduate entry medicine.
Yeah. Taanya, how can people best reach out to you if they want to ask you any questions?
You could find me on social media easily. You could find me.
It will be in the description.
Yes, so it's my socials. My name is pretty obvious to find, if I'm being honest. I've got a long last name. And my emails. Honestly, any way or form you wish to know about this, I'm more than happy to help. You also have, this is not Careers Advancement, but in this university itself, we have the career services. They've been really helpful for me myself. So you can obviously reach out to them. We have some faculty of health and medicine. They're really helpful in figuring out what you need to do next. But obviously, if you want someone who's already been through who's currently going through the process themselves, and what I personally have done so far for the medical application, feel free to get in contact with me or just Careers Advancement Network so that you can find me through that through the society itself. You could find life sciences, you can find the society itself. Just mention my name perhaps, and then they'll find me.
Yeah, I should mention, guys, you can find us in all social media platforms. Just search up Careers Advancement Network and we should be there. But I just want to say, Taanya, thank you so much for coming on the podcast today. It's been an absolute pleasure talking to you about the different pathways of medicine that people can get into. It's been an absolute joy.
Thank you for inviting me to be on the podcast.
I should also mention Taanya is our podcast producer. She switched roles.
Yes, it's been lovely to be on this podcast, both from the online side and also to be as a guest speaker. I hope this has helped some people. I know there's and I do like to reiterate that there's not many resources for graduate entry medicine as opposed to the normal undergraduate course. So I hope this has helped anyone who's willing to look into the graduate entry medicine side. And whether you've already made up your mind on being a graduate entry applicant, or whether you're still considering, you're sort of in between, figuring out whether you want to do medicine or not, I think definitely try looking into graduate entry medicine. Do some sort of experience, ask people around who are perhaps doctors or medical students, and I think medicine is a very rewarding career. It has helped a lot of people. It has helped people themselves, the doctors themselves, and it does give a really good form of fulfillment when you see the patients and see how they recover, even whether you're a doctor yourself or a medical student, or you're someone who's thinking of going down that path. It's definitely a career path that I would recommend.
Taanya, honestly, it's just been incredible you being here, and going down the medicine route is likely to be quite intellectually stimulating, you know?
Yeah, it is.
So I hope this is helpful.
Yes. It is a lifelong career, and it can be a difficult choice to make, but I hope that my words have helped someone in and around campus on deciding whether they wish to pursue or help them with the graduate entry medicine application itself. So please feel free to reach out to our society if you wish to know about graduate entry medicine. As someone who's going through the procedure, I'm more than happy to help. And also, if you have just any queries about life sciences, we've got our life sciences team. We've got also a lot of other specialty teams regardless of what career path you wish to go down to. And thank you for having me here, Sarah.
It's an absolute pleasure. And also to our listeners, please stay tuned for more episodes as we continue to share valuable insights into the world of work, helping you all navigate internships and graduate schemes. We hope you join us in our next episode. Goodbye for now.